We believe this data will better inform our plans to safely reopen our state and to determine what new normal mode of operation really looks like.
The state launches a new antibody study they hope will lead to the reopening of the state. The study being done through a partnership with the IU Richard M. Fairbanks School of Health at IUPUI. Good evening, everyone. I'm Brooke Martin.
And I'm Phil Sanchez. Testing will start as early as Saturday. News 8's Sierra Hignite joins us now with how it will work. Sierra.
During the governor's news conference yesterday, I asked State Health Commissioner Dr. Chris Box how we would ever really be able to truly know how severely the coronavirus has impacted Hoosiers. And today, she announced a study that hopes to do just that. The state has already started to reach out to people over the age of 12 to volunteer for testing in hopes of accurately reflecting the demographics of the state.
We will obtain scientifically valid results of the proportion of state residents that are currently infected, regardless of symptoms, and those that may have already been infected with the virus based on antibodies.
The study will use random sampling to test for the virus that causes COVID-19 and its antibodies to determine if a person has had the virus in the past.
Those agreeing will provide both a nasal swab to test for active viral infection and a blood draw to allow for antibody testing.
Dr. Nir Menachemi with IUPUI says this study is different from current testing endeavors that have focused on those with serious symptoms or that were high risk.
If we're only testing people with the most serious symptoms, it seems like we're only looking at the tip of the iceberg.
Brandon Sneed started showing coronavirus symptoms around St. Patrick's Day. He tested positive for the coronavirus.
I'm kind of curious myself, like, do I have the antibodies? Do I not? Can I get it again?
He underwent a test that a lab in Fishers is working on. It showed he was positive for COVID-19 antibodies.
I'm still really protective when I go outside in the public. Like, I'm still putting a mask on, washing my hands.
Though this is not the same test the state will be administering, it shows similar results, helping to paint a better picture.
This study will also give us better understanding of the extent to which individuals are showing antibodies that indicate signs of past infection.
There will be multiple waves of data collected with at least 5,000 participants in each wave. The first round begins on Saturday. It's important to note that only those contacted directly by the State Department of Health will be able to participate in this study. They'll be reaching out either by mail, email, text, or phone, and that communication started today. Reporting, I'm Sierra Hignite, Wish TV, wishtv.com, or follow us on Facebook.